بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Welcome everyone. أنا عبد الرحمن فرحات، أنا خريج من جامعة سليمان الراجحي. اختبرت اختباري ال SMLE من حوالي سنة. I gave my SMLE exam about a year ago. And alhamdulillah, I scored, I've given the exam only once, and I've scored above 80. And now I'm doing my internship as a research fellow. It's an extra internship as a research fellow and teaching assistant. So inshallah, this presentation you will benefit from. inshallah تستفيدوا من البرزنتيشن والشرح وهنستمتع سوا وحيفيدكم إن شاء الله. Okay. So موضوعي راح يكون إن شاء الله skin and subcutaneous tissue and يقع طبعا تحت السيرجري. أنا أشوف الشات، فإذا واحد كتب ممكن أشوف، بس إذا في أسئلة الأفضل تنكتب في ال Q&A section عشان ما يضيع بين الرسائل في الشات. I understand that it's preferred, I think, for some of you to explain things in Arabic, so it will be a mix, but it will be simple language inshallah, so everyone will understand. Okay. طيب. Again, same way everyone has presented before me, so we'll have some questions, we'll read them, بعدين حنشرح الموضوع وبعدين نجاوب السؤال مع بعض إن شاء الله عن طريق البولز. Okay. طيب. Let's start with the first question. We have a 7-year-old girl has spilled hot tea on herself while she was playing with the hot pot. Okay. She was diagnosed with burn. Now, is this burn thermal or non-thermal? You should be asking yourself. Okay. We will explain it, but just as heads up. Now, the question says, or the rest of the question says, inflammatory mediators play a major role in both the local burn wound and the systemic response to burn injury. What's the chemical mediator involved in the inflammation process? So we have serotonin, bradykinins, thromboxane, and epinephrine. Okay. So let's start. What's the etiology of burn? Okay. As مثل ما قلت في السؤال, عندنا thermal injury and non-thermal injury. Thermal injury can be caused by scalding or contact with hot surfaces, fires. Okay, and non-thermal injury can include radiation, chemical burns, and electrical burns. So عندنا نوعين من الحروق. في الحروق الحرارية وفي غير حرارية. تمام؟ طيب خلينا نتكلم عن الحروق الحرارية اللي هي most common. Okay. لما نيجي نقسمها احنا حنقسمها first degree, second degree, third degree, and fourth degree. Okay. So in the first degree, it's a superficial burn. Okay. Superficial means it affects the layers of the epidermis. Okay. Epidermis. طيب لكل واحدة من classification symptoms. Okay. فإيش السيمتومز حق الفيرست degree burn؟ عندنا pain. Okay. And erythema, احمرار. Okay. Swelling, dried out skin. Okay, but there is no blisters. That's important. Okay. هذا بالنسبة لي first degree burn. This is a common topic, so I will be going fast through this. Okay. When we come to something that is confusing or complicated, you can ask me to slow down. Okay. طيب. This is how first degree burn looks like. Okay. It's an erythema, it's a dried out skin, and it's painful. الحرق هذا ممكن أحيانا يجي من الشمس. If you go out in the sun and out with bare skin in the sun, you can get some of these burn. Okay. طيب, the second degree, we subclassify it to either superficial and deep. So the epidermis was affected the superficial epidermis was affected in first degree. It's affected here, of course, but we have the upper layer of the derms as well, okay? And in the deep, we have the deeper layers of the derms. Now, again, you have the pain, you have the erythema, you have the swelling, but what distinguish this second degree is you have something called the vesicles or the pullae, okay? So this is you would have in the second degree. Again, you would have in the deep second degree the vesicle and the pullae, but here the pain is minimal, okay? And I'll explain this in a bit. Why as you go deeper into the burn, the pain will decrease, okay? ممكن واحد يقول مهما نقول كيف كل ما انحرق زياده حيقل البين. I will حشرحها ان شاء الله. تمام. So let's see. Okay. خلينا نشوف الحروق السكند ديجري كيف تكون. شايفين هذه اليد؟ هذه اليد هي شكلها كذا من بعيد فيرست ديجري، لكن ما دام فيها فيسيكل اند بولي صارت ايش؟ على طول سكند ديجري. طيب كلها سكند ديجري؟ لا، هذا السكند ديجري في الاطراف هنا could be فيرست ديجري، ممكن هنا يكون ايضا سكند ديجري. تمام؟ انتم شايفين الماوس تبعي؟ اوكي، هنا نفس الشيء. شايفين هذا الحرق في and I have forgot to warn you actually guys, the pictures today are not so wonderful, so just bear with me for a second, okay? طيب الحرق هنا again, this is a large burned area of skin. Is it all second degree? No, but you have vesicles, you have pullae. This is definitely what? Second degree, okay? And you have perhaps first degree and the periphery, okay? طيب a third degree, you will even be confused that there is no pain, and even fourth degree that there is no pain. How do we differentiate between them? In the third degree, الحرق يوصل للsubcutaneous tissue. في fourth degree, you will see muscle, fat, and bones exposed. Okay, so you know تعرف انك وصلت للفورث ديجري لما تبدا تشوف تيشو، لما تبدا تشوف مصل، لما تبدا تشوف فات. اوكي، كلها تقريبا نو بين. ايش معنى كلام نو بين؟ يعني مثلا هذا البيشنت this is a third and fourth degree burn. هذا البيشنت ما عنده pain. definitely has pain, but in this part where it's actually fourth and third degree, okay, there is no pain, but here there is pain because it's a first and second degree burn. Okay, نفس الشيء هنا. This patient, you can see the subcutaneous tissue, and here you can start to see some of the soft tissue, internal soft tissue like muscle or subcutaneous tissue. Here you can see the subcutaneous tissue as well. Okay, so these all are what? Third and fourth degree. Of course, there is area of first and second degree. Okay, طيب النقطة اللي برجع لها ليش as we go there is no pain as the patient is getting severe form of burn, there is no pain. كل ما كان third and fourth degree ما في ألم. ليش؟ لأنه receptors of pain die with the burn itself. Okay, so there is no pain in there. طبعا ألم الحروق جدا شنيع. أنت لو شفت patient محروق على السرير حيكون صارخ. لما تجي تحط يدك على مكان الحرق حتشوفه صارخ أكثر، لكن لو كان في fourth degree أو third degree وتجي تحط يدك على مكان الحرق حتشوفه ما يصارخ. ممكن تستغرب. أوكي، طيب طيب we'll go faster. طيب في عندنا ال extent of burn or surface area involved. في ال SMLE they focus more on what we call the rule of nines. Okay, so you guys know this very well. Okay, so it's a rule of 9. كل جزء من الجسم نعطيه 9% as you guys can see. ال thighs all is 9, ال legs 9, ال torso is 18 but it can be divided 9. Okay, طيب في عندنا rules ثانية. yes, ايش الرولز الثانيه؟ في عندنا حاجه اسمها لاند بوردر تشارت، هذه ايج سبيسيفيك ومور سبيسيفيك، بس انها ما هي يعني ما هي فوكست في السملي. في عندنا حاجه اسمها البالم رول. البالم رول يعني تشوف البالم حق المريض it consists 1%. فلو كان عنده حرق على قد البالم تبعه بس انت مانك عارف هذا ما هو الثاي كامل، ما هو الصدر كامل، ف it consists 1% of the surface area burn. I hope I'm clear. اوكي طيب، شرحنا الاعراض حقت البيرن في نفس الحرق، لكن في عندنا clinical features systematic. اوكي طيب، في عندنا ممكن يكون البيشنت جاي والشوك including hypotension, acute respiratory distress syndrome, dyspnea like dyspnea, shortness of breath. اوكي and عندنا inhalation injury معناها البيشنت we'll explain it will come but how to suspect كيف تشك فيها عن البيشنت انحرق في مكان مغلق. اوكي كان في حريقه في مكان مغلق، في حروق في الوجه، في حروق في الانف، في حروق في الشعر، في الاي براوز والموستاش والبيرد. اوكي في سترايتر and dysphonia. اوكي and the burn is extensive. اوكي طيب، في عندنا شغله ثانيه اسمها circumferential burns. circumferential burns يكون الحرق جاي بشكل دائرة على كامل أي جزء من الجسم، ممكن يكون على الصدر بشكل دائري يشمل الصدر والظهر، أو على اليد بشكل دائري. هذا نوع من أنواع الحرائق لازم ننتبه معه ونتعامل معه بطريقة معينة حنشرحها أيضا في السلايدات الجاية. طيب هنا عندنا عشان بس أوريكم كيف الانهيليشن انجري تشك فيها أنها موجودة، نفس الشكل هذا، نفس الأشياء اللي قلناها، فهذه هي كيف حتشوف البيرنز في المستاش، في السوت اوف ذا نوز، حتشوف كل هالاشياء. تمام طيب، نرجع للسؤال. هذا السؤال ما انشرح and let's learn new things here. okay so ايش الكيميكال ميدياتور involved in the inflammation process of burn؟ يلا البول موجود قدامكم. Let's do it fast so we can go fast. okay just guess. I know we did not explain this, just take a guess. Okay, let's see the answer. Okay, so most of you guys actually answered bradykinin. So the answer is actually yes, it's bradykinin. And there are a few, and أكثر من واحد. So if you have histamine, prostaglandin, or bradykinin, and the answers are all correct answers. Okay, طيب. This is the first question. The second question. شفت البنت اللي في السؤال الأول اللي انحرقت وقلنا إيش الكيميكال ميدياتور؟ أوكي، نفس البنت. Actually, she spilled طيب راشد خلينا نجاوب على سؤالك later. أوكي نفس البنت اللي جت في السؤال الأول انحرقت، كأكشلي الحرق حقها كان في الرايت فور آرم. أوكي ومكتوب لك في السؤال إنه she developed circumferential right forearm burn. ايش معناها؟ شرحناه قبل شوي. طيب because you are a clever doctor you have put the oximeter on the right digit and it shows 86%. what does that mean؟ عندنا hypoxia في البيشنت ولا بس في الرايت فور ارم؟ طيب خلينا نشوف. وشلته وحطيته مره ثانيه عشان تتاكد because that's the first thing you do when you have such a thing and it showed 83. so it's unstable hypoxia in the right forearm. What's the appropriate next step? So you have bedside sclerotomy, measure the compartment pressure, send for imaging scan, discharge the patient home safely. خلينا نشرح حنجاوب على السريع. تمام طيب، العنوان هنا حنشرح في البيرن diagnostics. اوكي البيرن لما تشوف patient with burn most of the time it's a clinical history and physical examination. There is only few you can do as for tests and investigations. However, البلس oximetry here is very important. okay لانك حتشوف الهايبوكسيميا. الهايبوكسيميا ممكن تشوفها اذا كان البيشنت as a whole is having hypoxemia or in that specific part of the body where they have the circumferential burn. okay طيب البلاد جاز اناليسيز again حتشوف الهايبوكسيميا، حتشوف اذا عندك اسيدوسز بسبب البرن، وحتشوف الاشياء هذه. اوكي an inhalation injury حنزيد شويه اشياء. حنسوي شيست اكس راي عشان نشوف اللنج. حنسوي الكاربوكسي هيموجلوبين ليفلز. اوكي. حنسوي حاجه اسمها الانتايدل كربون دايوكسيد او والسيريوم لاكتيت. تمام. حنسوي كمان الرينال فانكشن تيست. هذه كلها الثلاثه هذولي is specific for inhalation injury. اوكي. الرينال فانكشن تيست for all patients to see because all burn patients are susceptible to renal injury. Okay, at the time of burn. طيب في circumferential limb wound or injury or burn حنسوي perfusion with pulse oximetry in that specific part of the body. Okay, and إذا كان أكثر من 90 it's fine. إذا أقل من 90 معناها you have what? Hypoxemia. معناها there is decreased perfusion of oxygen in that part of the body. Okay. طيب ايش المانجمنت تبع البيرن عموما؟ اي بيشنت حتبدا معاه A B C D E. This is a rule of thumb. اي حاجه في الاي ار، اي شيء في الاي ار حتبدا معاها A B C D E. You have to. Okay. Airway management, you guys know this, and then you will start the fluid resuscitation. طيب I will go fast. Okay. Fluid resuscitation, you all know the Barkland formula. It's 4 ml تضربها في التوتال. ليش نحسب احنا كم الجسم محروق؟ عشان حتفيدنا في المانجمنت. 4 ملي تضربها في النسبه للجسم محروق. Second and third degree only. We do not calculate first degree burns. Okay. وحتضربها بعدين في الوزن بالكي جي. طيب هذه الباركلاند formula. It's an old formula. Still some of the hospital use it. I think it's in the SMLE is still used. But في current guidelines من الامريكان اسوسيشن. لو حابين تقروا عنها اقروا. الرقم بس هنا 4 ml تغيرت. Be clever if the question is in SMLE is brand new and you feel like the question is new, it actually might not be 4 ml. Okay. It might be 2 ml. So the current guideline says 2 ml, but most of the time the question in SMLE are quite old, so it's 4 ml. You solve the question with 4 ml Barkland formula. Okay. طيب هذه كانت overall management. في you can manage the burn area itself by removing the clothes, irrigation, dressing, مرطب للمكان skin, and then again dressing is indicated in second degree burns. طيب لو كان في necrotic tissue, always in surgery. This is a rule of thumb. If you have necrotic tissue, you have to do debridement. Always. Okay? طيب في additional measures like prophylaxis and stuff you can be through. Okay? طيب هذا الديسبوزيشن حق البيرن. patient جاك بيرن في الاي ار، وين حتوديه؟ حتوديه على البيت، حتوديه على وورد، حتوديه على الاي سي يو، حتوديه على سبيشال بيرن يونت. هذه كلها على حسب الكرايتيريا اللي موجوده هنا. I will not go through it. You guys can go through it on your own. Okay? But this is very important because most of the time this question is asked. يعني it comes frequently in exams and even in real life. They will ask you where you will dispose the patient. Okay? And always before you say if you're discharging the patient, be careful with it. Okay? طيب. في circumferential burn, because this is a very special case, حتسوي Doppler test again along with the we agreed on the what's RL is ringer lactate. Okay. طيب حتسوي دوبلر، حتسوي الاوكسيميتر. طيب بعد ما سويت الدوبلر والاوكسيميتر there is no embedding vascular or respiratory compromise في circumferential burn. ايش حتسوي؟ elevate the limb, perform range motion exercise as tolerated. But if there is vascular compromise or compartment syndrome is impending, you have to do what? Sclerotomy immediately. Okay. And if you have compartment syndrome, then you will do fasciotomy. Okay. طيب غالبا لما يجيك السؤال ما حيجيب لك سؤال هو circumferential burn وما حيكون ايش في vascular compromise. So most of the time be clever. If you have a question with circumferential burn and most of the time there is vascular compromise, they want you to recognize how serious is the case is. Okay. طيب لو في النك أو الchest you will again do a sclerotomy. What is a sclerotomy? Sclerotomy is a kind of procedure. هي procedure معينة تسويها انك تفتح انسجن في الجلد على اساس الضغط اللي جوا الجسم يفك، على اساس انه ما يكون في compartment syndrome، ما يكون في التيشو inside dies. اوكي طيب نرجع للكويستشن. اللمب عنده رايت فور ارم. البنت هذه المسكينه اللي بدت معانا من اول البرزنتيشن عندها رايت فور ارم circumferential burn. ايش حيكون الجواب هنا؟ طبعا it's super clear that the patient has what? Compromised vascular injury. Okay. طيب what we will do and see that it says appropriate step. Okay. طيب خلينا نشوف الانسرز. I think it's quite enough. الانسرز bedside sclerotomy. Yes, this is the answer. Okay. اللي هو الجواب A. طيب ليش we are losing the limb here. We are losing the limb. اليد حتروح إذا if we wait more حتروح اللمب. Okay. When we chose B, when we measure compartmental pressure متى يكون الجواب B؟ حيكون الجواب B لما يكون ما هو مرة واضح إنه this is يعني superficial burn وفي compartment syndrome، ولما يكون you still have time. اوكي ايوه وهنا كمان afterward is not improving، يعني انت تشيل وتحط الاكسيميتر والبيشنت not improving, so you have to watch out. Okay, this is serious. We have to move fast. I'm sorry guys. Okay طيب question 3. انت بعد ما شفت البنت هذيك you took some rest in the ER after the girl case. نفس البيشنت هذيك الجيرل انت شفتها وعالجتها وحولتها وامور تمام واخذت شويه راحه. طيب اول ما جلست دخل كيس جديد على الطوارئ. الكيس يقول لك 5-year-old boy هالمره جايب facial burn. اليوم الليله كلها burns. انت على طول قمت لانه you saw this as serious and you have to act immediately ورحت على طول ايش examining the child and start doing the ABCDE. As you are doing the airway you see black soot over the nostrils and mouth. كل شيء شرحناها. وفي واحد قال لك that the carboxyhemoglobin is 40%. أنا كتبت هنا seriously why? Because carboxyhemoglobin, if you need to measure it, you have to take some blood. Okay, you have to take arterial blood gas to measure the carboxyhemoglobin. But let's say عشان هم يسهلوا لكم السؤال قالوا لك ترى عنده carboxyhemoglobin high. Okay, what do you suspect and what's the most important management? Will you call for help? Will you say that the patient has already died, carboxyhemoglobin مرة عالي خلاص? Will you give 100% oxygen? And will you intubate and ventilate? Let's discuss and then we'll come back to a question. Okay? طيب هنا what I'm trying to explain is one of the things that called burn sequelae. Burn sequelae معناها الأشياء اللي تنتج عن الحروق. هنا specifically we are talking about the carbon monoxide toxicity. الكربون monoxide toxicity يجي من الانهيليشن injury اللي شرحناها أيضا في البداية. طب إيش inhalation injury؟ قلنا لكم حتيجي بعدين. Damage to the respiratory tract. Okay, because of what? Because of hot smoke or the gases, the toxic gases. Okay. طيب الاتيولوجي قلنا hot smoke, particles, irritant, gases. Okay. clinical features قلناها هتشوف في facial burns، هتشوف soot، هتشوف burned hair in the face. The diagnosis is clinical. You see them, you diagnose the patient. تمام؟ ايش الcomplication? الcomplication are very serious and can lead to death. Okay? So you need to recognize immediately and manage accordingly immediately. Okay? طيب ما أعطيناكم المانجمنت هنا. أنا ما أعطيتكم المانجمنت. We will take the management in the question itself. So let's have the pool and let's see what do you guys think. What is the most important? So you guys know the diagnosis. What do you suspect? We suspect inhalation injury. What's the most important management? And we say most important management. What do you guys think? Let's 15 seconds. يلا. Okay, so عندنا في الانسرز 40% قالوا حنعطي 100% oxygen، 55% قال حنعطي intubation and ventilation. Okay, وفي كم كذا واحد 5% قال لا I will call for help
انا يعني not sure. طيب انت تشتغل في الاو ار في الاي ار سوري، انت ناو intern ولا resident في الاي ار؟ الاي بي سي دي is يعني is something that you do every second، مو every hour، لا every second هناك. ف you will call for help, that's definitely, but you will have to do something before calling for help. اللي قالوا give oxygen, it's correct, it can be correct. However, this is the initial treatment, okay? This is the initial management. The most important thing here is to intubate and ventilate, okay? So be clever what the question is specifically asking you. Is they asking you about the initial management? Are they asking you about the most important management? Okay, so be clever. Right. Okay, that's a new topic. Enough of the burn questions. Right. A patient had a fight in the streets 3 days ago and was stabbed by a knife in his hand. ما جاء الطوارئ، جاء عنده كذا جرح في اليد وراح البيت قال نشوف ايش يصير، والwound healed on its own. تمام. جاء البيشنت باليوم بعد 3 ايام من الستابينج wound وعنده hand pain, erythema and fever. What's your diagnosis? So we have quite a few diagnoses here: cellulitis, necrotizing fasciitis, erysipelas and hematoma. Let's explain and then we will see. طيب السكشن هذا راح نتكلم كله راح يكون عن skin and soft tissue infections. Okay, skin and soft tissue infection. Can you repeat the first topic at the end? Okay, we'll see if we can repeat things. Okay, طيب skin and soft tissue infection عشان اسهل لكم الموضوع حقسم لكم اياها types. Okay, ففي عندنا virulent skin and soft tissue infection، في عندنا non-virulent skin and soft tissue infections، and في عندنا necrotizing soft tissue infection. تمام. الvirulent skin and soft tissue حيكون زي folliculitis, furnicles and carbuncles والskin abscess. Okay, and من اسمها purulent. There is a lot of pus there. Okay, بعدين في عندنا non-virulent skin and soft tissue infection, and we have under these as erysipelas and cellulitis. طيب هنا although we say it's non-virulent، احنا قلنا non-virulent بس مو معناها انه ما في بس، مو معناها انه ما في بس، في بس. Sometimes these can present with pus. However, in their initial stage, in their initial presentation, most of the time, they do not present with pus and abscesses. Okay, so keep that in mind. Necrotizing soft tissue عندنا 3 and we will explain them. عندنا necrotizing fasciitis, something called gas gangrene and foreign gangrene. طيب هنبدا بالنون فيرولنت. نون فيرولنت قلنا هم ايش؟ الاريسيبيلاز والسيلولايتس. الاريسيبيلاز غالبا affect الابر ديرمز، السيلولايتس الديب ديرمز and subcutaneous tissue. تمام. ومن الديفينيشنز you can figure out which one is more serious. It's what? The cellulitis. Why? Because it affects deep. Okay. طيب ايش clinical feature؟ في local signs which is easy and you guys know it. في specific. And this is important because if they ask you about the diagnosis in the question, you need to know the specific signs for each one. طيب الاريسيبيلاس عندنا raised and sharply demarcated lesion. محددة بوضوح. الليجن حتشوفه محدد. السيلولايتس is poorly defined. وفي induration معناها الجلد قاسي. الجلد قاسي تحس انه كذا في تحته شيء، الجلد قاسي. تمام. طيب وفي systemic symptoms يتشاركون فيها جميعا: fever, chills, confusion, nausea. مو شرط تكون موجوده في كل الكيسز، حتكون في المودريت والسيفير انفكشن. تمام. طيب عندنا صورتين، عندنا هالصورتين هذه. اللي على اليمين شايفينها كيف؟ it's sharply demarcated. That's what we mean by sharply demarcated. واضح الحدود تبعها جدا. تمام. بينما هنا على اليسار لو قلت لك وين حد الليجن، وين بدأ وين انتهى كذا، it's not very clear. That's why what we mean by poorly defined lesion. Okay, so that's how you differentiate between the two of these. Okay. طيب etiology حيكون most of the time if you take proper history from the patient you will know that there was a minor skin injury at some point. ضرب رجله في خزانة، في دولاب، سكين جت في يده، حيكون في شيء. تمام. طيب في 100 واحد يضرب رجله في دولاب كل يوم، وفي 1000 واحد كل يوم ينجرح السكين، بس مو كلهم يجيهم سيلولايتس وإريسيبيلاس. ليش؟ اكيد في ريسك فاكتورز، صح؟ الريسك فاكتورز ابغاكم تحفظوها هنا، و this is for your clinical life, is that those patients tend to be immunocompromised or have immunodeficiency. For example, patients with diabetes mellitus are prone to infections. لو واحد عنده diabetes ضربت يده وجاله جرح، ممكن يجيله cellulitis أو erysipelas أكثر من البيشنت اللي ما عنده diabetes. AIDS patient, HIV patient, patients with cancers, patients on immunosuppression drugs. All these patients are what? Susceptible patients to develop such diseases. Okay. طب ايش organisms? The organisms the most common, and this is a very common area for question. It's a beta hemolytic streptococci. It's a group A streptococcus. Okay. It's Streptococcus pyogenes. All these means the same. البيتا هيموليتيك هو الجروب A streptococcus، هو Streptococcus pyogenes. تمام. طيب في less common organism, you guys read it on your own. Okay. طيب again, what is this? It could be a bit of both. It could be a bit of cellulitis and erysipelas, but you see that it's sharply demarcated lesion, so it's mostly erysipelas. Okay. طيب الdiagnosis هنا عندنا clinical signs, symptoms, history, physical examination. However ممكن نسوي احنا CBC عشان نشوف مثلا كم الليوكوسايتس، ونشوف is it decreasing or increasing. BMB is base metabolic panel, and what do we mean by this? We send for renal function test, liver function test, diabetes, glucose, and all of these. Why? Again, looking for the risk factors. Why this patient develops such a thing? Okay, there is a reason for that. Perhaps he's having what? Diabetes. Or inflammatory marker to know how serious is this infection. Okay. طيب imaging does not play a really significant role here. بس اغلب الاحيان نسوي ultrasound. وفي الالتراساوند this is the clinical information I'm giving you guys. In ultrasound you can see what we call cobblestone appearance, and I know you guys know this term because you have taken it in some GI diseases. You can see cobblestone appearance under the skin, for example, in the hand or in the thigh, for example, if you have what? Abscess or cellulitis or deep tissue infection. Okay. And this is sometimes we do it in the ER just to confirm the diagnosis, just so we are sure 100% that this is the diagnosis. CT and MR rarely done, but done for complications. Okay. Like for example, osteomyelitis. طيب. ايش التريتمنت؟ Treatment is antibiotic therapy. Based on the severity of the disease, we will give antibiotic therapy. Most of the time, هنبدأ empiric treatment. هنعطي something that will cover most of the organism, and we'll send for culture. And when we have the culture back, we will give specific antibiotic therapy for that. Okay. طيب ايش complication? You can read them on your own. But if things get serious, complication get also serious. Okay. طيب السؤال now again the question. So what do you think, guys, is the diagnosis? Let's have the poll, please. Yes. 15 seconds. So what's the diagnosis? Stab wound, 3 days, coming now with pain, erythema, and fever. What are we thinking? Okay. Let's end the poll and see the answers. طيب cellulitis، في ناس جاوبوا necrotizing fasciitis. نحن لسه ما شرحنا necrotizing fasciitis, but I appreciate you guys are expecting things. في cellulitis وفي erysipelas. طيب كيف نفرق هنا؟ كيف نفرق؟ طيب one thing is that I told you from the very beginning that erysipelas is a mild form, or it's less serious. Why? Because it's affecting the superficial layers, while the cellulitis is affecting the deep. And we have here stab wound. Stab wound means sometimes it goes deep. Okay. So عندنا stab wound وعندنا fever.
فيعني this is mostly what cellulitis, it's not erysipelas. okay. لو كان يبغاك تجاوب erysipelas كان قال لك the lesion is يعني sharply demarcated and you can see the lesion properly. okay. طيب الجواب هي cellulitis. تمام. طيب
Question 5. You have female patient who presented with tender swelling in the axilla. ساتنا في السكن subcutaneous tissue. بس هنا جاي في الأكزيلا. And it means something, okay? When you say axilla, it means something. History of repeated black head and large spore skin in the same area. What's your diagnosis? I know you might know the answer to this, but what's your diagnosis? If you know the diagnosis, you will know the management. If you don't know the diagnosis, you will just give it a try and take a guess, okay? طيب خلينا نشرح الdiagnosis. The diagnosis here is hidradenitis suppurativa, okay? And what is this? هذا inflammation للhair follicles والapocrine glands, okay? It's triggered by blockage of these glands. تمام؟ طيب ايش الريسك فاكتور حقها؟ obesity, smoking, family history. وين تجي في الفولدد سكين areas زي ايش؟ زي الاكزيلا، زي الجرون، زي الانر ثاي، زي البريانال area. okay. So you need to know the locations, because if the question give you these locations, okay, you start thinking, is this HS, is this hidradenitis suppurativa, okay. طبعا ممكن تتطور، يصير في عندنا abscesses، يصير في fistulas، يصير في keloids. Anybody here know what keloids mean? I hope so. طيب if you don't know, just search for it, okay. I would explain it, but it will take some time. طيب وحيصير عندنا sometimes sinuses, draining sinuses. يعني حيصير عندك زي sinus which open to the outside and it will give you a foul odor, okay. ريحة مو حلوة. طيب ايش التريتمنت حق الاتشس اللي hidradenitis suppurativa؟ طيب عندنا لايف ستايل ادفايس، عندنا الانتيبيوتكس، عندنا الريتينويدز، وعندنا السيرجري. Now it's important to know when do we give what. تمام. Lifestyle, of course you will start with all patients with lifestyle، صح؟ وهتقول lifestyle، but it depends also on the clinical presentation. So if the first time presentation of the patient is actually severe form, you will not only give him or give her lifestyle and send her home. No, you have to give lifestyle and treat, okay? Like most of the time we give antibiotics, and we give antibiotics in two forms. We give antibiotics as a cream, okay, as a topical for mild cases, and we give for severe cases we give oral, we give tablets for 1 or 2 weeks course, okay. Fine. Surgery only for cases that does not respond to antibiotics or medical treatment. تمام. Retinoid, I think most of you guys know what retinoid is. A retinoid does not play significant role in HS. So most of the time, if you see retinoid in the answers, it's most of the time wrong, okay? Do not choose it, please. طيب lifestyle advice, you can read it on your own, and of course you will, if you see a question that says what's the initial and the case is mild, it's not severe, or if you see a case saying this is a mild form of the disease, how you will treat, okay, so always start with lifestyle advice. However, if it's, let's see this question, what would you choose? Will you give her this female patient immediate surgery, topical antibiotics, cold compressor, and oral antibiotics? What do you think? 15 seconds. Yeah, faster. Let's end the poll and see the answers. Right. Most of you guys answered typical antibiotics. Now, I like how you guys are thinking. Okay, you start with the most initial step. Okay, it's not. I wish there was a lifestyle advice here, because I want to know how much of you would choose that. You will not choose lifestyle advice in this case. Why? This is a repeated complaint, and there is a swelling, and it's a tender. Lifestyle advice only initial and for very mild presentation. Such a patient actually deserves to be given a treatment, some kind of treatment. Okay, but what we will give him? Immediate surgery is never immediate. Okay, surgery is never immediate. Okay, topical antibiotics is for initial and mild cases. Cold compressor, actually I've searched this very well. Cold compressor, maybe if it was warm, maybe, but will you give this patient cold compressor? Is kind of lifestyle advice. Cold compressor or warm compressor are not appropriate here, as the patient has history of repeated infections. Okay, is this severe? It could be, because there is a repeated episode and it's tender and it's swollen. Okay, so look into the details of question. There is no much details here, but in the real exam there will be. If you feel that the case is severe, then you go for oral antibiotics. If it's not severe, go for topical antibiotics. Deal? اتفقنا? If it's repeated, you switch topical. If it's repeated, so if they tell you that the patient is presented initially and you give them topical antibiotic and they present again and it's not working, then of course you will give oral antibiotics. Okay, but if there is the first presentation and in the first presentation they say that there is repeated infection, then it might be in topical or oral based on how severe is the infection. I'm explaining most of the things in English. Are you guys comfortable, or would you like me to switch? Question: a young male has an open wound and he fell at the farm and the wound was dirty. The skin is dark and there is the gas in the tissue. What's the most common causative organism? They are giving you the diagnosis here. Okay, they are telling you that there is gas in there. Okay, although ممكن ما يعطوكم إياها بهالوضوح إنه there is gas in the tissue. Okay, but let's say that they give you this clear. Okay, this clear question. طيب خلينا. What's your diagnosis? I want to see in the chat. Please write in the chat. I want to see you three writing the diagnosis. I want to see if you guys pick the diagnosis. What's the diagnosis here? Diagnosis. I don't want the answer. Okay, gas gangrene. I see gas gangrene. I see necrotizing fasciitis, gas gangrene. Okay. Let's see. Let's first know the diagnosis, and then we will know the answer. Okay. So this part is explaining the necrotizing and soft tissue infection, which include the necrotizing fasciitis, gas gangrene, and foreigner gangrene. Now, there are only few differences between necrotizing fasciitis and gas gangrene, but we will come to explain them. Okay. And foreigner gangrene is a part of necrotizing fasciitis, but it affects a special part, which is the external genitalia. طيب. But this is what? This is necrotizing fasciitis. تمام? This is gas gangrene. Now, will you be able to differentiate if I did not tell you? It's a kind of difficult, but let's see the clinical features and then we will know. طيب. And this is, I'm really sorry for this picture. This is the foreigner gangrene. So you'll never forget it again now. Okay. This is the foreigner gangrene. It's affect the external genitalia. Okay. And I would actually tell you a story if you guys remind me at the end of this presentation about foreigner gangrene, which a case I had during my studies. So, but because of the time's sake, we'll just move on now. Okay. Like, etiology for necrotizing fasciitis. ايش الكوز؟ عندنا aerobic and anaerobic. عندنا gram positive and gram negative bacteria. كل انواع البكتيريا موجوده. So it's most of the time polymicrobial. أكثر من bacteria, more than one type of bacteria causing this issue. Okay? However, it can be monomicrobial. Sometimes one bacteria can cause this. Okay? لما تكون polymicrobial حيكون عندنا a lot of pathogens included. Aerobic, non-aerobic, anaerobic, gram negative, gram positive, a lot of things. Okay? لما تكون monomicrobial, mostly common is what? Group A Streptococcus, which is what? The Streptococcus pyogenes. Okay? And then you have Streptococcus species, and then you have the Staph aureus. Okay? So these are the most common. If it's monomicrobial. But most of the time it's what? It's polymicrobial. Okay? طيب. ايش clinical feature حق necrotizing fasciitis؟ عندنا fever, chills, systemic symptoms, cutaneous finding حتشوفها في السكن، حتشوف diffuse erythema. طيب diffuse erythema كانت في cellulitis، كيف نفرق؟ think that you suspect cellulitis, but it's not responding to antibiotic therapy. So think what? Think necrotizing fasciitis. Okay, this is a clinical correlation, guys. Okay, هتشوف tenderness, هتشوف something called pain disproportionate. Okay, this pain disproportionate to the presentation that you see. So pain out of proportion, think what? Necrotizing fasciitis. You will see crepitus. Crepitus means gas. Okay, you will see bullae. You will see skin necrosis. Okay, I will try to speed up again and speak some Arabic as requested. طيب ايش المانجمنت؟ المانجمنت start immediate surgical and medical treatment for this patient. ما كانت زي النون بيريولنت، ما كانت زي اللي اخذناها قبل. ما حنعطي antibiotic therapy وامبريك ونستنى. No, you have to do surgical intervention immediately. Okay. السيرجيكال حيكون debridement، وهو confirm the diagnosis وحيكون as a part of the management. تمام، حتعطي antibiotic. You will admit to the ICU. You see how serious the thing here. You will admit patient to the ICU most of the time. Let's say some of the time you will admit the patient to the ICU. Okay. وحتعطي طبعا adjuvant therapy as required. Okay. ايش complication? It can lead to amputation and death. We are super serious here. تمام. Why cortisone injection is not treatment option? Okay, we'll come to that later. If you remind me about this question at the end of the presentation. Okay. طيب. أنا بالنسبة لي إلى الآن الكويشن ما هو clear. ليش؟ لأنه إلى الآن we did not explain gas gangrene. طيب. حاعطيكم شوية hints هنا. أنا الجدول هذا يخوف. أنا كان ودي أشيله لكن حطيته لأنه important. How to differentiate between necrotizing fasciitis and gas gangrene. You have the risk factors. Read them. Etiology قلنا هنا polymicrobial and monomicrobial. هنا عندنا شغله اسمها كوليستيديريوم بريفنجينز. اوكي، او بريفنجينز. اوكي، الكلينيكال فيتشرز هنا شرحناها، وهنا في ايرلي وهنا في ليت. من الكلام اللي قاعد نقوله واضح انه اتس بروجريسيف كونديشن. حتبدا شويه you will think it's cellulitis, sometimes you start antibiotics, not improving, now you recognize it's serious. اوكي، هنا although it rapidly progress to necrotizing fasciitis، بس هنا حيبدا sudden progressive pain out of proportion على طول. No kidding is there. Okay. وهنا في triad. Sudden progressive pain, tachycardia, and feeling of impending doom. What's impending doom? Impending doom is feeling that something serious is happening. The patient will tell you, doctor, I'm dying. Doctor, there's something serious happening with me. When patient says such a word, you know it's something serious. Okay. Like, again, what's the answer here? You have the bull. Quickly. Let's see the answers. طيب. I like you guys. I like you. 88%, 88% جابوا Clostridium perfidus. Yes, it's the correct answer. Okay. Why? Because we have risk factors like falling in the farm, the wound was dirty, and there is gas in the tissues, can become darker. Okay. And you will hear some words in the scenario. You will know immediately it's gas gangrene, like suddenly, immediately. Okay. So you know it's gas gangrene. Okay. Good. Okay. Again, this question 7 should be very quick. Okay. So immunodeficient patient with a perianal swelling and crepitus. There is a clear discharge and he's in severe pain. I think we've explained this in the and I already told you about the picture, right? So what will you do? Now, I put this slide just to wrap up things, okay, for you guys about the management. You can read them on your own. Again, if you have crepitus means what? There is gas in there. There is gas in there means what? It's no longer what? It's no longer cellulitis. It's no longer normal abscess. It's no longer erysipelas. It's something causing necrosis. It's something falls under necrotizing tissue infection. Okay. And when we see this, how to manage? Immediately. Let's start the bull. Immediately, we know that we have to do something. And this thing is called, yeah, let's have answers, please. Quickly. This is surgical intervention, and we mean by this debridement. Okay. Right. Question 8. Question 8. Okay, I will just go quickly through the scenario. We have a patient coming to the ER with eye pain, okay? And they give you a distraction here. They tell you that the patient never been vaccinated before. This is a distraction, do not be fooled, okay? So we have two things. We have orbital cellulitis and periorbital cellulitis or preseptal cellulitis, طيب? And this is how it looks. How to differentiate between them? Orbital cellulitis, I will go through this in the picture so you will know, but let's just go through the clinical features, okay? في preseptal cellulitis is milder form. These two are what? Are form of cellulitis. Preseptal cellulitis هيكون في pain, هيكون في swelling or erythema, but it's less serious from the name. It's preseptal, let's see, before, okay? في orbital, things are happening inside the orbit, okay? So we have proptosis, we have ophthalmoplegia, okay? And these are cardinal signs. If you see them immediately, you think orbital cellulitis. It's not preseptal anymore, okay? تمام؟ حيكون في fever, حيكون في malaise, حيكون في reduced vision. All these are serious symptoms, تمام؟ treatment for both are antibiotics. Preseptal حنعطي ممكن نعطي oral, ممكن نسوي admission, depends on how serious. But في orbital, it's always IV. And you have to admit the patient because the complications are serious. Patient might lose the eye. Okay. طب نرجع للسؤال. Let's have the pull. خلينا نشوف البول. Again, this patient complain of right eye swelling. Read the scenario, guys. And the right eye swelling. 2 days. She could not open her eye. She never take vaccination. The eye is swollen and there is pus. What do you think? Let's have 10 seconds. Okay, let's see the answers. Okay, most of you answered orbital cellulitis, and this is the correct answer. Okay. ليش السيمبتومز اللي هنا في swollen eye هو حيكون في swelling في البوث but لما يكون all the eye is swollen and there is a proptosis like it's pushing outward الeye جايه طالعه برا كده تمام. This is orbital cellulitis تمام. وحيكون في عندك reduced vision, diplopia, ophthalmologia, وحيكون في very severe pain when the patient try to open the eye and if you try to open it yourself. لو لاحظتوا هنا في الصورة patient can open the eye. This is preseptal. Here it's orbital. Patient cannot open the eye. If you try to open, the patient will yell at you and it's very painful. Okay. طيب هنا بس أنا أوضح لكم preseptal. شايفين كيف جاية؟ هنا جاية. This is preseptal. This is orbital. You see where the inflammation is going? It's inside the orbit, okay? And it's affecting the muscle. That's why you have ophthalmoplegia when you pain when trying to move, when trying to open your eye, when trying to see things, okay? When try to look left and right, okay? These are complications. And one of the serious complications is what? Cavernous sinus thrombosis. And how to suspect it? You will see neurological symptoms in the face. That's a topic for another day. Okay, question 9. Elderly patient admitting to the ICU for a long time. He has comorbidities, a lot of stuff going on. But what we are concerning about, now he has developed bed sores. And the bed sores show necrotic skin and subcutaneous tissue. What's your management? So let's just quickly take the topic and then we'll go through the management, okay? Right. Bed sores also, you might hear some words like decubitus ulcer, pressure ulcer. It's all the same. It's all the same. It's a pressure ulcer. It's decubitus ulcer. Okay, and it happens where because of unrelieved pressure. So واحد عمره 70 سنة 80 سنة 90 سنة داخل مستشفى ICU نايم على السرير ما حد يحركه في بريشر على هذه الأماكن اللي تشوفونها الأحمر. The red areas are affected more frequently than the blue areas. Okay. Because of the pressure, okay? This is the more frequent affected areas, okay? طيب patient نايم على السرير ما حد يحركه, is not being mobile, nobody is moving him, he will develop what? Bed sores, decubitus ulcer, pressure ulcers, all the same. طيب ايش risk factors? These are the risk factors. Read them on your own, but know that prolonged reduction in mobility, okay, or in perception of pain or in skin perfusion are all very important risk factors. تمام؟ It's microbiology. Again, it could be polymicrobial. but if it's the most common isolated bacteria are Staph aureus. Okay, like we have stages for that. Stages are very clinically important because the management will depend on what? On the stages. Stage 1, you have intact skin. Stage 2, there's a defect, but it's in the epidermis plus minus the dermis. Stage 3, there is loss of all skin layers and only you can see the subcutaneous tissue. Stage 4, you see the muscle, fascia, tendons are born. This reminds us of what? It reminds us of the degrees of burn. It's similar. This is how it looks. This first degree. Skin is intact. There is a defect here in stage 2. It's only superficial. Here you can see the subcutaneous tissue. Here we see the muscle. Okay, that's why it's stage 4. Right? How do we approach in the management? If it's superficial, then it's just supportive care. If it's extensive, if there is necrotic tissue, and I told you this from the very beginning of my presentation, if there is necrotic tissue, the only treatment we do for necrosis is what? Debridement. You have to take the necrotic tissue out. It does not have to be in the OR under sedation. Most of the time, we can do debridement for such a patient for bed sores in the ward, okay? Just cleaning the wound and taking this necrotic tissue out. طيب? And the rest of the management, you can read them on your own. The supportive care and wound management, okay? طيب. What's the management in this patient? So this patient it clearly states that there is necrotic skin. So we know there is debridement, but will you do skin graft, assisted vacuum, primary closure and secondary closure? Okay, I can see there is a bit of confusion there. طيب 47% 47% جاوبوا D. 20% جاوبوا C. 20% جاوبوا B. 13% جاوبوا A. معكم حق. الموضوع ما شرح في المانجمنت. Okay, you know it's debridement, but there is a next step in here. Is it skin graft? It's never skin graft, guys. It's never skin graft and bed sores. You don't do skin graft. Okay? طيب خلي لي B على طرف شوي. Is it primary closure? It's never primary closure. No primary closure in bed sores. Why? Because there's infection there. Because there is a long-term wound. الwounds أخذناها. If it's clean wound, if it's just a few hours ago, then you do primary closure. Otherwise, it's never the answer. So bed sores are never clean wounds. You never primary close them. Okay? But we are left with B and D. I'm gonna say the answer. The answer is D. Okay? The assisted vacuum, we only use it in some special cases. Okay? In most of the cases, what we do is just we do debridement and do dressing and let the bed sore heal on its own. تمام؟ الvacuum, assisted vacuum. Okay, so we have conflicting answers. Some of the guys says it's assisted vacuum. I've seen. I'm not gonna say hundreds. I'm not gonna أبالغ الموضوع. I've seen tens عشرات the cases of bed sores with necrotic tissue. Assisted vacuum, first of all, it's not available all the time. Okay, and it's used in more serious cases. And it's used where there is pus collection and when there is, there are some special cases where you use assisted vacuum. You can, if you are convinced that the answer here is B, you can go with B. But I would answer D, and I'm almost sure 100% that the answer is D. Okay, so you guys choose whatever you like. Okay. No, secondary closure is not using chemicals. Secondary closure means you let the wound heal on its own. Okay, so you do not stitch the wound, you not close the wound yourself. Okay, so that's my answer. You guys can search your own and make sure, but if you want to take my answer, inshallah, you will score more than 80%, which I did in my exam. طيب, last question, and then I'm relieving you guys. Okay, 27-year-old young patient with long history of swelling in the thigh. Now, I suppose that swellings in the skin in your minds كده مرتبطة ب cellulitis, erysipelas, necrotizing. Okay, that's why I'm giving you this question, just to tell you that there are other kind of swellings and still it's not cellulitis or this kind of stuff. Okay, the swelling is mobile and the skin is smooth. Okay. Okay, examination shows that there is positive fluctuation test. What is fluctuation test? Fluctuation test is when you hold the swelling with 4 fingers, using 2 fingers in each hand, and then you press with 2 fingers, you will see that the swelling is fluctuating and reaching the other 2 fingers. Okay, so what's your diagnosis? Let's just read about this. And I'm really sorry that this part actually needs a lot of reading. I'm just going to explain lipoma, but you need to differentiate between all other types. Okay, طيب ايش الليبوما? benign tumors subcutaneous of subcutaneous soft tissue. Clinical features عندنا slow growing. That's why in the question it says long history. So it's slowly growing, and sometimes it reaches to its size and then stops growing. Okay. It's rubbery, it's soft. All these were in the question. So you know what? They were, this is what they're trying to say. It's lipomas, okay? Non-tender, so it's non-tender. Can be located anywhere. There's a special type. This is an extra information. It's called lipomatosis, where you have multiple lipomas in the body, okay? And this is autosomal dominant. Not very important information, but just for your information, okay? It's a clinical diagnosis. Most of the time, treatment. This is important. Treatment. Lipoma, what I used to call as something. If you remove lipoma surgery, it's like luxurious thing. It's most of a dala. That's why they do it most of the time in private hospital. Okay, surgical excision only considered in few cases. There is pain, cosmetic reasons, and not all cosmetic reasons we do, and if it's growing rapidly. Okay, otherwise lipoma can stay there for life and nobody will do anything about it. You see these are lipomas, and there are 4 lipomas. If you see such a thing, you know it's the special type, you know it's lipomatosis. Okay, so what's the diagnosis here? Without the pool, without anything, I'm sure 100% guys will answer it correctly. It's what? It's lipoma. Okay, this is lipoma. This is very clear. طيب. Thank you very much, guys. What I would like to say, you guys have reached almost to like a very late stage of your career. Now you're doctors. Now you're about to be doctors. 5th year. You're giving the SMLE exams and other exams. So don't stop. Push harder. Keep going. You're about to go into the real stuff. Okay. So just keep going. Push harder and don't stop. Okay. I would be happy to accept any questions. Now, before you leave, guys, please do not forget the form. It's very important to me, and I would highly appreciate it if you fill the evaluation form for me. Okay, so because I have another presentation in a few days in the OB/GYN week, so I will use your feedback. Thank you very much. I really enjoyed talking to you. And I will accept the questions for 10 minutes. If we have time, I will definitely tell the story. So why cortisone injection not treatment option? I think this question was asked in regarding to the hidradenitis suppurativa. I did not. Thank you all guys. شكرا لكم. Why cortisone injection is not used? I did not come across any cortisone injection and for such a treatment. However, cortisone does decrease the inflammation. Please read about this point. Make sure I did not come across any cortisone injection. Okay. طيب. Iman is asking to repeat the burn topic. There's no more questions, so I will be answering your. I will try to repeat. So what exactly do you need to repeat in burn? In burn, first degree will affect the superficial derms. In the second degree, it will go into the derms and the deep derms, okay? الله يعافيكم جميعا. الله يعافيكم جميعا. You are very welcome, guys, and I was happy actually to explain, talk to you guys, okay? So how do you differentiate? The main thing here, they all have pain, but in the second degree burn, you have what? You have pullae and vesicles. This is the thing, the key word about the second degree burn. You have what? You have pullae, you have vesicles. I hope I answered your question, Iman. Any more questions? Who wants to hear the story? I actually forget in which part I was telling the story. So if you remind me, guys, I will tell you the story. If we have time, I don't know. Moderator, do we have time? Where did I tell you guys that I will be telling the story exactly? I forget. Yeah, foreigners gangrene. Yeah, definitely. So is there time? Let me just check if there's time. Okay. Oh, we're very sorry. There is no time. I'm really sorry. I have to listen to the moderators. I don't see any more questions, so I think we're good. Oh, there is. Okay, done. No more question. Okay, good. Well, have a great night. Bye bye.